and whether or not instructions were whether or not the students were able to understand these competencies or do this. And these are the scores, and it was really just a small N of about 24 schools. So we don't have big numbers, but truly they're not impressive, we might say, regarding some defined competencies. Others that have been added to that are clinical health assessments and interventions, being able to have some contingency strategies, recovery strategies, public health law, and ethics. Another set of competencies have been developed for public health workers. I'm not going to go over all that individually, but they have been out since 2003. They've been identified for anyone working in the public health arena in the U.S. should be competent in these particular skills. And they go with continuation of them. The ICN may be a set of competencies that you all utilize here in your curriculum in disaster nursing. ICN is the International Council of Nursing. It's a federation of nursing organizations from all the countries. And they have nicely reduced competencies to follow the phases of a disaster. And that's very good. And their competencies are related below, as I've indicated, in terms of risk reduction, disease prevention, health promotion, what you need to be able to do in terms of preparedness and relief, as well as recovery and rehabilitation. So the competency movement is a component of disaster healthcare and will continue. And it also does reflect sort of the changing culture of healthcare education globally, in that we're moving more from a shift from acute care to community care and to population care. And there's a bigger emphasis on that. And so it's in keeping with that also. We're shifting more from single discipline and profession training to intra-professional training and interdisciplinary training, in which public health students and medical students and sometimes dental students and nursing students are taking the same courses together, are working as teams on the same project. And I will say, just having said dental school, the Dental Society in the U.S. as well as the Veterinary Society in the U.S. is also now including some disaster preparedness courses in their curriculum. With that, I'm going to end. I gave all my business cards but one within the last 5 days away, and consequently, I put this up there at the Birnbaum and our contact information. Sometimes even you already have good information, maybe even good data and studies. You need help in getting it written up in English that can be published in a peer journal. We certainly are willing to help and work with you on any of those projects. You all have a wealth of information here in your country. We would like to see some of it. A few questions, Julie, please.
Deep understanding about the role and competencies related to the health workers and also nursing. And I just remember when Elaine gave me a lecture when we were in Bali, in Denpasar. And suddenly I remember that I already read her papers. Actually, their papers, because it was written by both of them, Marvin and Elaine. It's about competency and competence. So how we difference about competence and competency and competence. It's very good paper. So please, if you have the time, you have to read that paper. It's in the Pre-Hospital Disaster Medicine Journal, as far as I remember. Okay, so now we start for the question and answer session. So please raise your hand, and if you do have questions in your mind, please. Okay, lady at the back. Yeah, lady at the back first.
First question is, I'm going to ask to Mr. Morgan. You were talking about getting rid of hazard in order to prevent some event or to occur, or at least to make the damage really less severe. But a lot of times that hazards are unexpected in their nature. And for example, like what happened in Yogyakarta in 2006, people were so busy preparing for a volcano eruption because that's what was expected to happen during that time. But instead, what was happening that time was a huge earthquake that destroyed almost the whole province. So my question is, what's wrong in the hazard mitigation here? How can we prevent this from happening? And is there any way to do the hazard mitigation that will cover all prevention needs? My second question would be for Ms. Elaine. My question would be how to maintain the healthcare coordination control running well during the acute phase of the disaster, because you were talking about the coordination and the control among the systems, because they were divided into certain kind of systems in the community or society. Because it tends to be, the coordination and control tends to be unorganized when a chaos is happening. And what are nurse roles in keeping the coordination and control going good? Thank you.
Thank you, Maria. And Martin, you will have to answer the first question, and Elaine for the second question.
I think the way that people in general are managing that is to first take an all hazards approach. What kinds of things can you do for all, to look at all hazards? And so there's a lot of education and training to prepare people, regardless of the hazard, to be able to do some things. So they're saying, many people are saying that instead of preparing for a specific hazard, you should find those things that are common and try to prepare for as many as you can, because there are common elements in those. And I think that's what needs to be defined, of what are the common elements and what can we do to be prepared. So does that answer your question?
Okay, how's about the answer? Maria?
Yeah, I think that's pretty much clear for me. Thank you.
Yeah, and I would venture to guess that if they were really, truly prepared well for the hazard of the volcano, some of that helped them also with the earthquake and tsunami. And that's the goal when you do an all hazard, is that it should be there should be overlapping with other events. It shouldn't only be unique to one event. And then regarding coordination and control and how to make that work the way it's supposed to work. And the only way that can ever happen is, number one, that's agency or entity is defined, and you work with it through drills and exercises, drills and exercises, drills and exercises. So that who is in charge and who coordination and control is never in doubt. There's no confusion about that. Everybody knows it. Everybody's on that same page.
I think there's a tendency to bring up coordination and control mechanisms only after an event has occurred. And I think that's catastrophic, because they've never met before, they have not participated in the planning process. So I think coordination and control mechanism has to be operating 24/7 and has to be supported 24/7. And it's difficult to get that happening. A good example is the health clusters in the United Nations system, in which people are brought together to do coordination and control. It happens only if the event occurs. And coordination and control mechanism then goes into the country to help them with coordination and control, and often take over coordination and control. And that's a catastrophe in itself. So the question is how the other organizations that are coming in interrelate with the national government or the local government. Those are major problems right now. So we're working at it, but you can see that there's a tendency of the United Nations, for example, or the World Health Organization, to come into a country and try and take over. And the Minister of Health doesn't like that, as you can imagine. So I think these things have to be worked out, and we really have to emphasize it. Also, coordination and control takes special training and experience. And so how do you develop that within the country? And we were encouraged in Bali, because the Minister of Health was there, and she basically laid out what has happened in Indonesia since the earthquake and tsunami. And there's been huge progress made in terms of provision of coordination and control, with 9 centers, operation centers being developed across the country, and now I think the 10th one is in development. And that's huge. It's a huge progress. So in Indonesia, you're going to have at least 10 emergency operation centers, which are essentially coordination and control centers, working to prevent this from happening.
I think I'm sure I'm not telling you anything new, that in Thailand, just before the tsunami, they had just drilled and exercised within months of that event. That has a profound effect. Honestly, I cannot overemphasize being involved in drills and exercises.
Okay, after the answer. Okay, so next to the yes, the gentleman.
I want to ask Ms. Elaine. In one of your slides, you mentioned that we should have a family plan disaster preparedness. Yeah. Can you give us more explanation about what should we do for the family plan preparedness for the disaster? Thank you.
Yes. We have food and water supply, non-perishable food, and a water supply for a minimum of 72 hours. Minimum of 72 hours. You need to have a communication outline, communication system for your family members outlined. How will you get in touch with each other when the phone line is down, when the satellite systems are overloaded and you can't get through? Who will be a contact person? Where will you go if you're in danger? If you can't get back home from work, where will be a meeting place? Identify those. Identify who and how to communicate with your neighbors. So perhaps if just some family members are at home, you can't get home, or you are at home, you need to know, coordinate with your neighbors. This is what we're going to do. We'll all meet here. We're all going to do this. This is how we're going to communicate with each other. So we have just kind of a couple big gallons of water stored away in the storage in our basement. We have flashlights with working batteries that every now and then I remember to check. Not as often as I should. We have a little candles and some matches so that I can see if I have to see. We have food, plenty of non-perishable food for 3 days, and that doesn't rely on any cooking or refrigeration or anything special to open it and use it. And then making sure you know and have ready access to necessary medications. If you're insulin dependent, where is it? Is it handy? Can you get to it for your grandmother? Will it be there? Do you know where it is? Does everybody know where it is, not just you? Does everybody in your household know where necessary medication is at?
Yeah, I think the medication issue is a big one. because there are many people that are dependent upon medications, and if they don't get them, they'll die. And there's a big problem because the supplier is gone. The pharmacy or the hospital in which they would depend is gone. So they need to have a supply of medication that will last them potentially